Labyrinthitis, aka vestibular neuritis, brought to you today by Katisha Williams and Tyler Yoles. Pathophysiology of labyrinthitis. Labyrinthitis, better known as vestibular nephritis, is inflammation or infection of the inner ear by viral or bacterial pathogens. The bacterium or viruses enter the inner ear from the middle ear and or the bloodstream, most often caused by drug intoxication or overindulgence in alcohol. Acute and chronic otitis media is another underlying cause that spreads into the inner ear, which can lead to permanent hearing loss. Signs and symptoms of labyrinthitis. Most common symptoms of labyrinthitis is vertigo, tinnitus, sensory neural hearing loss, nystagmus, which is involuntary eye movements. Other signs and symptoms a patient may experience are dizziness, pain, fever, ataxia, nausea, vomiting, beginning of nerve deafness, and difficulty concentrating. Who does labyrinthitis affect? While labyrinthitis can affect people of all ages, the condition is most common in adults between the ages of 30 and 60. Studies show that females are twice as likely to develop labyrinthitis than males. Some triggers of labyrinthitis is having the common cold or flu or being under a lot of stress. Smoking and drinking excessively large amounts of alcohol can also trigger labyrinthitis, and certain drugs such as antidepressants and anti-inflammatories. Diagnostic test. Labyrinthitis is diagnosed by your healthcare provider. The provider will perform a physical examination and ask you about your symptoms and your medical history. They may also order tests to assess your hearing, balance, and other nervous system functions. There are several other conditions with the same symptoms, so your healthcare provider will want to rule those out. They will start by running certain tests. For example, they may order a CBC, an MRI, or even a hearing evaluation test such as Rennie and Weber. Common medications of labyrinthitis. Labyrinthitis treatments depend on the root cause of the infection. For example, if labyrinthitis is caused by a virus, then the healthcare provider will prescribe antiviral medications. And during this time, the patient may be placed on bed rest. Other common medications would be antibiotics. Antibiotics are used to treat bacteria infections, antiviral medications, which I just went over. Antiemetics will help control symptoms such as nausea and vomiting. Antihistamines have been proven helpful with symptoms such as dizziness on an individual basis. Also, the patient may be prescribed a mild sedative to help the patient relax. Nursing management for labyrinthitis. We will educate our patient on symptom management and self-care. We will also encourage our patient to seek supportive care on coping with anxiety that may be due to frustration, due to the patient losing their job, or due to the patient losing their hearing. Now we are up to the part where you can participate in this presentation. I have included 5 NCLEX style questions. Question number 1 states, the nurse is contributing to the plan of care for a patient with labyrinthitis. What is the primary goal for this patient that the nurse should recommend including in the plan of care? Select all that applies. Is it A, prevention of falls? B, patient can continue to work full time? C, preserve hearing? Or D, management symptoms? If you answered A, C, and D, then you are correct. Question 2. The patient comes to the health clinic for a suspected ear infection. Which of these data collection findings does the nurse expect with labyrinthitis? A, fever. B, tinnitus. C, vertigo. D, dizziness. Or E, all of the above. If you answered E, all of the above, then you are correct. Question 3. The nurse is reinforcing teaching for the patient with vertigo. Which of the following statements made by the patient would indicate further teaching? A, I will avoid loud noise. B, I hopped up quickly and ran to the kitchen. C, I will increase my fluid intake. Or D, I will lie down for safety. If you answered B, then you are correct. A patient with vertigo should rise slowly from a sitting position. Question 4. The nurse is assisting with discharge instructions for a patient. Which medication would the nurse teach the patient that can possibly cause hearing loss? Select all that applies. A, Tylenol. B, erythromycin. C, furosemide. D, gentamicin. Or E, tobramycin. If you answered D and E, then you are correct. Patients shouldn't use these drugs while diagnosed with having labyrinthitis due to these drugs being oxytocin drugs. Question 5. The nurse is caring for a patient who is diagnosed with labyrinthitis. The patient asks, what type of disease is this? Which is the most appropriate response by the nurse? A, infections of the external ear commonly caused by moisture. B, it is a tumor of the 8th cranial nerve. C, a hardening of the staples due to the new bone growth. Or D, inflammation of the inner ear caused by either viral or bacterial pathogens. And if you answer D, then you are correct. Labyrinthitis is inflammation of the inner ear and can be caused by either viral or bacterial pathogens. And in conclusion, we hope you learned something about labyrinthitis. Thank you.